I'm Dr. Timothy Scharle, primary care internal medicine, and I work at St. Luke's University Health Network. I like internal medicine, primary care, because I get to deal with all branches of medicine as opposed to being a specialist where you deal exclusively or the majority of the time with one branch. I get to know my patients best by spending time with them. I like to ask my patients questions periodically like, what do you do for fun? What's new and exciting? Things that bring out more about a patient rather than just their health. Stories are very important because they tell me about an individual as a whole as opposed to isolated issues as to why we may have such and such a medical problem. Everything influences the whole picture. Mrs. R may appear to be confused, but it actually has to do with the fact that she can't afford her medicines and she's embarrassed to say that. So rather than say, I don't know how to take my medicines, she'll pretend like she does and go on from there. If you don't look at the whole picture, you don't know that information and make incorrect judgments about how someone's doing. My promise to my patients is to be the best, most thorough, most knowledgeable, and compassionate primary care physician that there is. My practice is different from others because we go out of our way to take our patients through the medical journey as a team. Specifically, we call patients back on all results, normal or abnormal. We do all scheduling from our office. In my free time, I would say the two things that I do most often are concentrate on my family, and actually I like to read medicine as a hobby. My favorite thing to do in the world is to read on the beach, especially medicine. I like to bike ride with my wife. Well, I like to listen to music. My wife and I go to concerts. That's been going on for a long time. My wife and I are sort of Def Leppard groupies, even though I shouldn't admit it. One other thing I would mention is that our practice/office is a great team. I have 5 assistants who help me, and they really go out of their way to go out of the box to help patients.